Okay, welcome back to part 4. We're talking about anti-cancer drugs. We're talking about CV drugs. We're talking about hormonal drugs. We're talking about antimicrobials. So we just talked about this MCQ. All of the following are beta-lactamase agents except, and the answer was C. Tetracycline is not a beta-lactamase agent. Okay, next one. Oral terbinafine is used to treat what specific types of dermatophytic infections? So we have A. Tinea capitis, B. Tinea ingroin, C. Tinea onychomycosis of toenails and fingernails, and D. Tinea corporis. And the answer is C. Tinea onychomycosis of toenails and fingernails. So if you remember that the tinea capitis is on the head, tinea ingroin is in the groin area, and tinea corporis is the skin on the arms. Oh gosh, I'm forgetting. I think that's what it is. Anyway, these are antifungals. Okay, next one. What major dose-limiting adverse reaction can oral terbinafine cause? So, A. Nephrotoxicity, B. Toxicity, C. Hepatotoxicity, D. GI toxicity. The answer is hepatotoxicity. So a lot of fungals can cause hepatotoxicity. The liver, so you will need short treatment, so you will need to be checking the liver and enzymes. Remember, some of these drugs can cause lupus or SJS, Stevens-Johnson syndrome. Terbinafine hydrochloride is a synthetic alumine antifungal. It is highly lipophilic in nature and tends to accumulate in skin, nails, and fatty tissues. Terbinafine is used to treat fungal infections of the toenail and fingernail. Terbinafine is a class of medications called antifungals. It works by stopping the growth of fungi. So something similar here is ketoconazole and grisovolin. They also have this adverse reaction, which is similar to oral terbinafine. So what is grisovolin? This is a antifungal drug that is administered orally. It is used both in animals and humans to treat fungal infections of the skin, commonly known as ringworm, and nails. Grisovolin is used to treat skin infections such as jock itch, athlete's foot, and ringworm, and fungal infections of the scalp, fingernails, and toenails. Okay. So what is the mechanism of methotrexate? A. Inhibits dihydrofolate reductase, DHFR. B. Complexes with iron and reacts with oxygen, which in turn leads to DNA strand incision. Sorry, that's a mistake. It's not incision, it's scission. And C. Covalently binds alkylation to DNA, leading to cross-linked and dysfunctional DNA strand. D. Inhibits DNA topoisomerase 2 formation of free radicals, leading to DNA strand scission, not incision. So what is scission? Anyway, the answer is A. It inhibits dihydrofolate reductase. That's the action of methotrexate. What is scission? Single-strand scissions, etc. For example, in DNA. The bleomycins, for example, are a structurally related group of anti-tumor antibiotics used clinically in the treatment of certain malignancies. The mechanism of action of BLM is believed to involve DNA strand scission, a process that requires O2 and an appropriate metal ion. The therapeutically relevant metal is probably iron or copper. Next, penicillin is inactivated by beta-lactamases. In which of the following organism? Is it Staph aureus? Is it Haemophilus influenza? Is it E. coli? Or is it all of the above? The answer is A. Staph aureus. Is that right? I think I wrote the wrong answer here. I think the answer is D. Yeah, the answer is D. Penicillin is inactivated by beta-lactamases. By Staph aureus, Haemophilus influenza, E. coli. Yeah, the answer is D. I wrote the wrong one. Pretty sure about that. Remember that beta-lactamases and penicillin are deactivated by gram-negatives using the porins in the outer membrane. If it is an extended spectrum antibiotic, however, it may work against E. coli. Which agent is responsible for the manifestation of toxicity? Red man syndrome. So the choice is SMX, antifolate. B, gentamicin, which is an aminoglycoside. Don't forget that gentamicin is an aminoglycoside. And C, vancomycin. The answer is C, vancomycin. Successive cephalosporins, the first of the fifth generation, provide greater gram-negative coverage and weaker gram-positive coverage. Is this true or false? It's true. Remember that there's a sliding scale from the first to the fifth generation where they become more gram-negative and less gram-positive. And don't forget that Pseudomonas comes in the fourth generation, if I'm correct. Next one. Pseudomonas resistive cephalosporins. Next, what antimicrobial agent can cause C. diff? This is A, choice clindamycin, B, tetracycline, C, methicillin. The answer is C, methicillin. No, it isn't. The answer is A, clindamycin. What am I doing here? Clindamycin can cause C. diff. Others can cause C. diff to overgrow, but clindamycin is known for it. That's right. So ignore that answer. The answer is A, clindamycin. Next one, inhibitors of DNA synthesis and integrity, antimetabolites, folate pathway inhibitors, and topoisomerase inhibitors. In fact, which part of the cell? Is it the G1 phase, the G2 phase? Is it the S phase? Or is it, well, the answer is C, it's the S phase. S phase DNA synthesis occurs, so that's where you have the inhibitors. As a side note, etoposide. This drug is used to treat people with testicular cancer or small cell lung cancer. Your doctor may use it to treat other types of cancer as well. Etoposide forms a ternary complex with DNA and the topoisomerase II enzyme, which aids in DNA unwinding, prevents religation of the DNA strands, and by doing so causes DNA strands to break. Which of the triazoles is used in the treatment of invasive aspergillosis? What am I doing? These questions are all stuck together. Anyway, I stuck that in there because I wanted to remember what etoposide does and to connect it with topoisomerase II. Don't forget that. Next question, which of the triazoles is used in the treatment of invasive aspergillosis? Invasive aspergillosis. Is it A, fluconazole, B, voriconazole, or C, itraconazole? I thought it was fluconazole, but the answer is C, itraconazole. Alright, so we're almost done here. So aspergillus, think of the fungal ball when you think of aspergillus. Primary affects the lungs, causing 4 main syndromes: allergic bronchopulmonary aspergillosis, ABPA, chronic necrotizing aspergillosis pneumonia, also termed chronic necrotizing pulmonary aspergillosis, aspergilloma, and invasive aspergillosis. However, in patients who are severely immunocompromised, aspergillosis may hematogenously disseminate beyond the lungs. Itraconazole has a broader spectrum of activity than fluconazole, but not as broad as voriconazole and posaconazole. In particular, it is active against aspergillus, which fluconazole is not. Okay, see if we can go to the end here. Actually, I think we need to take a break and come back. It's going to get too long.